We're very lucky today to have Courtney present to us about using NAPS data to drive local quality improvement and research. Courtney is an antimicrobial stewardship pharmacist and a NAPS project officer and postdoctorate fellow with the National Centre for Antimicrobial Stewardship. She helps lead NAPS related research and will be presenting to you all about today and give you some practical tips and tricks on making the most of your NAPS data.
Thanks, Josephine. So we'll go back to the beginning. Let me go. So I was asked to talk about how we can use our NAPS data to drive local quality improvement. I'll be talking about how you use it at a local level, how we use it at a national level, and how we can use it for other research purposes as well. I will talk, I think, for most of the time, but there'll definitely be time for questions. So, but always use the Q&A functionality to ask questions so that we can go through those at the end. As always, we would like to acknowledge the traditional custodians of country throughout Australia and recognise their continuing connection to land, waters and community. We at the NCAS RMH Guidance Group pay our respects to them and their cultures and to their elders, both past and present. As Josephine mentioned, this is one of many series. All of our sessions are recorded, put available on the NAPS website and also on our NCAS YouTube channel to refer back to at a later date. And as you can see, our auditing periods have been updated to be till the end of the year. So make sure that you're aware of that. I mean, part of this talk about how to do research is obviously you don't want to leave it to the 31st of December, but that is obviously an option. It is available all year round. So in terms of NAPS for quality improvement, so if you attended last month's talk, it was about the QI NAPS. So thanks to Ron, some of these slides are a bit similar. But yeah, the whole point of quality improvement is to make a difference in improving patient safety, effectiveness, and experience of their care. And antimicrobial stewardship as a concept of what that is shares many common elements of that with quality improvement. Antimicrobial stewardship is all about improving patient safety, making sure they get the right antibiotic, the right time, right dose for optimal effectiveness, but also, again, their experience of care. So there's lots of overlap there. Ways to do quality improvement, a common way is audit and feedback, which is the NAPS and why you're all here. So auditing is reflecting and wanting to understand what's happening in current practice and how to improve it. So identifying problem areas, and audit is only so good on its own. You can audit, but if you're not feeding it back, then how do they know what the problems are and how do you generate any meaningful change? So again, feeding it back to the relevant people, the prescribers at an organisational level, whatnot. And then auditing itself can be part of research, education, so forth, and trending measures over time because you have those data points from your audits. In terms of NAPS for research, so I have been informed I'm old and Play School apparently has 4 windows now, but I will only talk about 3 windows. We're choosing our own adventure today. We'll go through all these options, but it's when we talk about NAPS for research, we can talk about your existing NAPS data. We talk about collecting new data through the NAPS platform specifically for a project in mind. And then as part of the NAPS, we do have a large de-identified data set that can be used for research purposes. So we'll talk a bit more about that later on too. So first is more about, well, understanding what your NAPS data actually looks like. So if you wanted to do a research project or quality improvement with the NAPS data already in your hospital, like under your facilities subset or platform, you need to understand what that data looks like. So how have you collected the data? Have you done a hospital NAPS, surgical NAPS, aged care? Also, we've now got our QI and antifungal NAPS too. And then what methodology did you do? In your hospital NAPS, have you been doing point prevalence or have you been doing directed audits? Because you don't want to be mixing and merging 2023's data, which was a point prevalence, with your 2016 data, which was directed and just looked at ceftriaxone or just looked at cellulitis. So it's really important to understand what exists in your data and how it was collected to ensure that, from an ethical and perspective, that you're looking at like for like comparisons. Similarly, for your surgical NAPS, did 1 year look at orthopedics, another year you looked at cardiothoracics? It's just important to understand the context of what your data is. Did you do all procedures or just one procedure? And did you include the 30-day outcome module or not? Or did you only include it for 1 year and not another year? Because with our NAPS, when you build out your survey each year, there's additional fields you can ask to include. So it's important to know what they were, what was included, what wasn't, because when you want to compare from year to year, if that's something you're going to do, you need to know what it is. And similarly for aged care NAPS, did you do method 1 or method 2? So method 1 is a single day. Method 2 is the single day with a 30-day look back. So understanding what you've already got before you go ahead. And another big one is, all right, what if that's how you did it, but how much have you got? So if you're only doing 5 scripts a year and you've been doing it for 6 years and you've only got 30 scripts, can you do anything meaningful with that data? Probably not. If you've been collecting NAPS consistently over years, you might have a large data set of 300 prescriptions and you can do some more interesting things. But most importantly, you want to be making sure that it's of the same methodology for consistency. In terms of what our NAPS data looks like, so there's lots of process measures, so indicators that assess whether actions or steps are carried out as intended. So that's documentation of an indication or a review or a stop date. And then we've got our quality and outcome measures that assess the end results or the impacts, or the effectiveness of our stewardship efforts. So guideline compliance, appropriateness, and things like the 30-day outcomes in the surgical NAPS. And then as a trick question, there's also data like defined daily doses and days of therapy. That's actually not us at NAPS, that's NORSP. You probably already contribute data to NORSP. There are also great outcome measures to include in any research projects. You're just not going to get it out of our platform, but it's worth clarifying with the NORSP team once you've got a project or something in mind, how best to use that data. And if you're already submitting data to them, they would, I'm sure their team would be more than happy to help you understand and how to use that data to complement what we do here at NAPS. So then the next sort of thing is, if you're going to do a research project, you need to have a research question. And why does that matter? Because if you have a clearly defined question, it's going to lead to clearly defined and a well-focused research project. If you don't know what the question is, you don't know what data to collect to answer that question, and then you don't know what the answer is going to be. And it all just cascades awfully from there if you don't know what your research question is. In terms of how to do that, a common framework is called the PICO method. And what that looks like is you want to identify what your patient or problem is, the intervention, if there is one, a comparison, if there is one, and what your outcome is going to be. So as an example, you've got you've been doing the NAPS a couple of years now, you notice that ceftriaxone is commonly prescribed at high rates of inappropriateness, but specifically in your general medicine unit. You might know that through doing the NAPS, or you just might notice that anecdotally and you want it just from your work on the ward, and you want to explore that. So an intervention itself could purely just be doing the NAPS, audit and feedback. So you might want to do a directed hospital NAPS audit of just ceftriaxone prescriptions. But, you want to be defined in what this, we know it's going to be patients on ceftriaxone in a general medicine unit, and you're going to look at a certain time frame. Are you going to look at a week? You're going to look at a month? You're going to look at a year's worth of data? And that's going to come down to your capacity to collect that data and do a NAPS assessment on all those prescriptions. You could just do audit and feedback, or you could do an additional intervention. You might want to do education about education to the general medicine unit about when ceftriaxone is indicated, when it isn't indicated. You might think that there needs to be a local guideline developed. And essentially what you could do is you could implement those interventions and then redo your NAPS audit and feedback at a defined period afterwards to see did compliance and appropriateness improve after all that happened. And that's where your comparison data would be in. So you would have your NAPS before, your NAPS after, and what did that look like? And then in terms of outcomes, similarly, like we talked about our outcome quality measures, things like guideline compliance, appropriateness, and also, not just the appropriateness, but what were the reasons for inappropriateness? Is it the wrong indication, the dose, the route, the frequency? Is it because the spectrum's too broad and there's a narrower agent? That is a meaningful information to feed back to the clinicians to improve their prescribing. And then, you can take this example and you could just change ceftriaxone to metronidazole. You could change that to cellulitis as an indication, purely tailoring it to whatever you wanted it to be. In aged care, you might want to look at prophylaxis of ceflexin for UTI prophylaxis. You might want to look at topical clotrimazole or PRN orders and how often they're used. So again, changing this up to suit your context. And, we're obviously happy to help you refine these questions if you're not sure where to go, where to start. But, the NAPS team, we're all experienced clinicians with a bit of research experience as well. So we're happy to help, you work through your queries. In terms of what NAPS for research looks like and what the data currently exists. So in the bottom left-hand here, it's just highlighting that you as an organisation have consented to be part of the NAPS. So there's an agreement between your organisation, you as an end user, and NAPS. You collect your data and it goes into our little NAPS platform house here. So that is an agreement between us, but you own that data. We just house it. And it's really important to know that the organisation or your facility, you're responsible for your data. Again, we don't encourage the use of URs or MRNs because it's potentially re-identifiable data, not at our level because we don't know your organisation, but within your own facility. So that is managed by you. You own that data. You can do research. You can do whatever you wish with that data. If you want to publish, if you want to present somewhere, you can, but you need your own ethics because that is separate to us. You just used our platform and our data tools and our appropriateness measures, so our intellectual property to do that audit. In the middle, as part of that agreement, so we receive partial funding from the Australian government, the Department of Health and Aged Care. That agreement is that data is de-identified at a hospital level. So the Department of Health doesn't know which prescriptions came from which hospital. And it's a de-identified aggregated data set that we use to write our national reports. So that's a requirement for us at NAPS as a delivery of this program, that we provide those annual reports as part of the AURA response and the national AMR strategy. And you, as your facility, have signed up to the NAPS, you're contributing to that program. And that's what our national reports look like for hospital, surgical, and aged care. And then on the far side, we also have what we call our NAPS aggregated de-identified data set for research. So our NAPS is part of RMH Guidance Group and Melbourne Health. We have submitted a Melbourne Health, a HREC, a Human Research Ethics Committee application to be able to do data analysis and research projects with the data. Again, it's de-identified at a hospital and patient level. And what we anyone can apply to do research with that data set. We have a committee that reviews those applications. And again, I'll talk more about that towards the end, but that is another avenue to do research. So, at your local level, you might only have 100 scripts, and that might not be much to do a project or an analysis on, but you can apply to us to get access to that data, which could be 100,000 prescriptions. So, bit more, a larger data set. But again, there's other things that also need to happen. You still need to get your own local ethics application in place too. Before I move on, there was just another point I wanted to make. At the local level, at your facility level, when I said you need to get ethics, you need to at least consult with your hospital or your facilities ethics steering committee or organisation. Generally, quality improvement projects, especially if it's just a local project, doesn't need to have a full-blown HREC like ours, but every organization's different. So it's important that you go through that process, because it might not need to have a full ethics application, but you still need to submit something to your organization that you're intending to do a quality improvement project and publish that. And if you want to go down the publication path later on, one of the questions when a journal reviews that up your submission is, did it undergo any ethics review? And then you can say it was reviewed and we didn't need to do an ethics application, or it was reviewed and we did this pathway. So it's really important to have that at the local level sorted before you go down any of these research paths, because you might get blocked later on. And that would be a real disservice for all the work that you would have done. So if you're going to do research, where do you present your research? So your first one could be, what we recommend is having your NAPS data done and the report sorted to present for your local World Antimicrobial Resistance Awareness Week, which will be the 18th to the 24th, 23rd of November. It's the same dates every year. It's just whether that 18th starts on a Monday or a Tuesday or a Sunday and so forth. It's a good opportunity to raise the awareness of the work that you're doing under your AMS, QUM, IPC profiles in your organisation, and also, an opportunity to provide broader feedback of the results that you've collected. Some larger hospitals also have annual research weeks, so you can submit abstracts to your local hospital about work that you've done, and you can present your findings there. And then otherwise, there's also lots of national and international conferences. So there's many, but I've just listed a couple that are relevant to nurses, pharmacists, AMS, and infectious diseases, because that tends to be our audience. So you've got ASIPSI. SHPA is now rebranded as Advanced Pharmacy Australia. They have their annual Medicines Management Conference. We've got ACID, we've got ASA, ACCPA, which is the Age and Community Care Providers Association. That's coming up in October this year. So all of these ones, it's important to be aware of when they are, at what time of the year, and when things are due to submit, because obviously this, for example, ACCPA is October. Their abstracts would have been closed for a while now. So, but maybe something to consider for next year. And then in terms of some bigger international ones, so APIC is an American Infection Prevention Control Conference, and ESCMID Global, which is around April every year, and in Europe. So in terms of how to submit your research, most conferences would require you to submit an abstract. It's normally around 200 to 400 words. The conference website would obviously have their own guidelines and tell you what that looks like. But some tips for that, you really want to have a clear and concise title for your abstract presentation. You want to have a good structure, which I'll talk about at the end. On a bullet work. Yep. So when we talk about structure, normally you have a bit of a background, the objective or aim of the purpose of your research, what methods you use, like you use the NAPS tool, highlighting the main findings, and then what the implications are as your conclusion. It's really important that you focus on the results and the significance of the results, because that's what's going to attract the reviewer, the abstract reviewers. It's important that it's well written, it's clear, there's not lots of jargon and medical terms or abbreviations. It's always good to have someone else review and proofread what you've written to make sure that it might make perfect sense to you, but if it doesn't make any sense to anyone else, then there's a bit of a problem. And then the last tip I have there is some conferences will have a theme. So if you can pitch your abstract to reflect the relevant theme of that conference, then that obviously makes it more appealing to get accepted. And then if you are accepted, what's next? So normally the process is that you apply and you might get accepted as a poster or an oral presentation. And then I've just shared this as an example of what not to do. There's lots of ways to do a poster, but this is an example from the internet of what is not ideal. So you can see, for example, here that they've put the whole abstract, like a whole abstract in there. You don't need an abstract on top of your abstract. The introduction section below is very, very long. It's just so much text. Like no one's going to want to read this. If you walk past this, you're not going to stop and want to read it because there's so much text. Same thing with a lot of the images. There's too many. You'd have to like go right in to try and read. And look, I know this picture's blurry on purpose, but that's just, the concept there. Even like this crammed, all the margins, everything's crammed. There's no space around it at all. The figures, the captions aren't aligned. And yeah, just a lot of text, poor use of space, and just not really appealing, unfortunately. And even like they've got that picture of what the facility looks like in the top right-hand corner, like not useful, doesn't add anything to the poster, a bit of a waste of space. So then what makes a good poster? So Caroline Chan is one of our NAPS project officers and our PhD student with us. We just celebrated 10 years at the Doherty Institute where our group is based last week. And Caroline represented one of her NAPS research posters there, and she won best poster presentation. So I thought that was a good opportunity because it was recently recognised as being a great poster. So obviously we've got our brand recognition at the top so people know who we are. The introduction, methods and results are succinct and clear. It looks really small here because I've had to fit it onto the screen, but in terms of like what's considered appropriate from a text perspective, it's an okay balance. And fortunately, for the methods section, you can see there it was scanned for more information and it takes you to another resource if they're really interested and want to read more, and also creating engagement for the user. If they're walking past your poster, then they might, scan it or be on their phone to remember for later on. The figures aren't too complicated. You can see clearly the numbers, and there's a bit of explanation on the side. On the far right hand, there's a key summary. And then also what's important, we'll talk about a bit later on, is that we're acknowledging the NAPS program and you guys, because you help collect the data and contribute to the program. And then some key conclusions there. And I'll just move my mouse so I can see it. And also not as obvious there, but some key points in the conclusion are bolded, so it stands out to the viewer a little bit more as well. And then I've made that a bit bigger so you can see, your introduction doesn't need to be thousands of words. It's just 2 key points. Sorry. And similarly with the methods and the higher level results there. So then the next one is about you've been accepted for a talk or an oral presentation. Now, this is not my slide. If you go to the link down the bottom there, Carolyn Holmes, I think she's in the US, an associate professor in political science, and she's done this thing on the world's worst PowerPoint. And she said there's lots of ways to screw up a PowerPoint presentation. So first of all was that transition. that paper plane that just jumped across the screen. That's distracting. You might think it's fun, but for a professional presentation, not really ideal. And then similarly, putting way too many words on a slide, even if they're bullet points, no one's going to read them. They're not going to pay attention to what I'm saying because you're too busy reading all this text on the screen. And then even when there's really small text, what's the point? To give your audience a migraine, she suggests. Not great. And then the concept of having too many colors, inconsistent fonts. There's some pretty fonts, pretty ugly fonts. And even the slide, one of her comments in the part of this presentation she made is like, am I trying to sell ferns or plants? Like, why have I picked this random slide? So yeah, there's lots and lots of ways to screw up a PowerPoint presentation. There's lots of functionalities in PowerPoint. You don't need to use them all. But then, so what makes a good oral presentation? So we don't have to include everything on the slide. You don't have to have heaps and heaps of lines of text and not many words per line. You want to keep it simple, consistent, and readable, and have places to add or cut for time. So, I had a picture before and I spoke to the picture. It didn't need heaps of text around it. And obviously, the other big thing is you want to practice and practice in front of other people so they can give you feedback. So that's about abstracts and conferences. But then the next point I want to talk about is, well, you've done your research and you want to look to maybe publishing it in a journal. So same thing as I said before, make sure you have the relevant ethics approvals in place. That is first and foremost a huge thing to get right at the start. And if you do have questions about that, I mean, we can help navigate that with you. Obviously, it's very organization specific, so we can help you try find the right person at your organization to talk about that too. And then in terms of like how to pick a journal, so you want to pick something, what the journal scope is and the audience. You don't want to submit a journal, submit a manuscript about cellulitis to a fungal journal. Not relevant, not the right readers. And it's probably going to get rejected anyway because that journal's going to be like, this doesn't match anything else that we've published. So when you're looking around, it's also good to look at what the journals have published in the past, and if it's a similar content or topic. You want to look at the journal's impact and reputation. So impact factors help there. Unfortunately, there's a whole range of things, what we call predatory journals. They charge a lot of money and for you to publish with them, but they're not reputable. So we're always happy to help, answer any queries if you want to, query the reputability of a journal. And similarly, most journals, I hope, should be peer reviewed. That means that when you submit your manuscript to the journal, it'll get reviewed and evaluated by an expert and highlights that your paper is of high quality and acceptable to be published with them. Another thing is you want to know what the access of that journal is. So some journals are open access, so anyone can access your publication once it's accepted and made available, or you need to be a subscriber to that journal or have, your hospital or university might have a subscription model to access that journal. So, you might not want to submit it to somewhere that isn't open access or restricted because then no one's going to be able to read it. And then other requirements, you want to look at what the formatting, what the word count, what their referencing is like, and also how much it will cost to publish with that journal. Some are free, some have their fees waived through your relevant facility or university, and others are not, and they're very expensive and can cost anywhere between $2,000 to $4,000 US. So that will probably be a big defining factor because it's not something routinely, I don't have a spare $4,000 US to go publish. So that is definitely a factor that I consider when I look to publish any research. And then I just wanted to highlight some recent NAPS related publications. So Simone for the first one, metronidazole prescribing practices, and then below that is Sarah, who published on skin and soft tissue management. And to the bottom right is Alex on IV amoxicillin clavulanic acid. These guys are medical students through the University of Melbourne who collaborate with us at NCAS. So we do take on medical students for research projects, and that's where we use that de-identified aggregated data set that we do already have existing ethics for. A big thing to note with that is for them, they are not regular NAPS auditors. They aren't familiar with the process. So that is why they're not solo authors on these publications. They do collaborate with our team to produce that data. For us, we think it's a great way to get more people engaged and understand and learn about the NAPS. And we want, to publish more about NAPS research to get the good news of what the NAPS is all about in the public space, to get an understanding of the importance of appropriateness for antimicrobial stewardship. And, we hope that, people can read these papers and get ideas. I'm like, yeah, metronidazole is a problem in my hospital. Maybe I do want to do a local quality improvement project. Or same thing for IV amoxicillin or similar for cellulitis. In the top right is appropriateness of anybody prescribing for oral and dental conditions. So Leanne is a dentist and an NCAS collaborator. And similarly, she hasn't done a lot of NAPS auditing herself, which is why she paired up with our team to collaborate and write a paper on that subset of NAPS data. So you don't have to have us as co-authors, but if the way that our processes work is if you were to submit a request, like all of these guys did, we would recognise that there was no one on their research group with NAPS experience, and that's where we step in and help. And that's sort of the points that I was going to make. So from that, what's the process to apply to NAPS for a de-identified data set? So it's normally born out of an email inquiry or someone interested in wanting to reach out to us on how to do research with us. So we do have relevant policies in place. So our NAPS research dataset requests guideline and also our dataset publication policy. So that part of those policies includes forms for the request for you to submit. And that's things like, what are you wanting to look at? What's your research question? Same thing, like if your research question is to look at DDDs and days of therapy and you send that to us and we're like, that sounds like a great project, but our data isn't going to answer that. So we're not going to give you the data because it's not going to answer your question. If your question is about guideline compliance and appropriateness, then that's something we can help you with. So yeah, it goes for review from our NAPS steering committee. So that's why I said those that aren't familiar with NAPS, which is obviously not the people online today because you're all NAPS auditors. And we still can co-author and help as long as we meet the international requirements for authorship, and that's never going to be an issue. And then, so that's just to get approval to access our data set, but we're not going to give out any data until you still have sought your local ethics approval. So we can conditionally approve it, and then once you've got your local ethics approval, we can then give you that data. But obviously, to write your local ethics application, you need to know that, they need to know that there's going to be this data set and how it's managed, and we can obviously help you with your local ethics application. And then finally, that end goal is that, it's important to acknowledge and reference our NAPS program in your relevant publications and presentations. Because at the end of the day, whilst you have collected the data, you didn't develop the tool. The tool is developed by us at the NAPS. And with that comes, intellectual property, and important to acknowledge the sources there, as you would for anything else. So nothing out of the ordinary there. In terms of how to acknowledge the NAPS, so we have a couple sentences about acknowledging our users, so you guys, like we don't exist without you collecting the data, so it's really important that you are all properly acknowledged. Obviously, we can't list all 5,000 orders individually, but as a general statement, we have to acknowledge the people that fund this program, so our RMH guidance group and NCAS, and obviously the Australian government. And then also ensuring that in terms of citing the program, we want citations of the actual programs. and the annual reports. And the recommended citations of the annual reports are actually within like the first 1 or 2 pages of our annual reports. So nearing the end. So in terms of what we offer from a NAPS research support services, so, we can help answer any questions about research design. We're happy to help review some content and help write up your methods. Like, we know the NAPS methodology quite well. So if you are a bit stuck or not sure how to word something or phrase something, we're happy to help. And similarly, if you want us to help review an abstract or something like that, like if you've already started and just a bit stuck, that is something that we are keen to help you with. It's sort of what takes us from our program, not just being about an audit. We want to help with the feedback. We want to help drive quality improvement, not just locally, but nationally. And our team is growing and we have, the resources to help. And, I think that's what makes, very biased, but makes our program so good. And that's why we've been around for over 10 years. And similarly, we can make sure that everyone's been appropriately acknowledged. From an NCAS University of Melbourne Research Support Services, like that's where a lot of us have dual roles and appointments, so we can help with all of the above that I've just mentioned. But we do also take on masters, PhD students, and mentorships. So that if that is something of interest, reach out. If you follow us on socials like LinkedIn, we recently just attained over $3 million in funding to be a centre of research excellence again. And with that comes funding for some PhD opportunities. So follow us on LinkedIn, on X, register for our NCAS newsletter, and we'll hopefully in the next couple of months start advertising those positions for those that are interested in that level of research. In saying that, you don't need a master's or a PhD to do local quality improvement or to submit an abstract to a conference. But we're just highlighting that we do have a range of opportunities of support across our program. And as always, contact our support team. So support@naps.org.au. I'm sure many of you are familiar with that email by now. And then we'll leave it now just for some questions, but I'll leave it on this screen so you can see what the upcoming webinars are going to be. So thanks everyone.
Thanks, Courtney. That was very informative. We're now open for questions. Sorry, I'm just hearing my voice echo. Feel free to use the questions and answers box to ask any questions. Alternatively, if you want to raise your hand, I can unmute you so you can ask your question. While we wait for questions to come through, Courtney, I wanted to ask about the process for publishing to a journal and how long that process usually takes.
Yeah. Can you hear me okay through your headset? Yes, awesome. So the process for publication to a journal, so every journal has their own platform or website and requirements. I think COVID definitely made it an even longer process because, everyone was so busy working back clinically. The peer review process by many people, it's goodwill. Like I review articles for journals all the time. It's not a paid thing. It's for the love of research and, supporting research and academia. So I do that in my spare time. But, sometimes it's hard to find people to review or the right person to review. Like I've been asked to review some certain papers and I'm like, oh, that's not really in my expertise. Like I don't feel comfortable that I'm the appropriate expert to review that, which, it's always flattering, but, you can't, if you're not the appropriate expert, then they have to find someone else. And that takes time and it's on goodwill. And normally they ask us as a reviewer anywhere between 2 weeks to 4 weeks to review. But they've got to find that person that agrees to it first. So you could submit September, It could take them 2 to 3 months just to find someone willing to review. And they might be like, look, I can, but I'm busy. I can't do it in 2 weeks. I need a month. So we've gone from September, October, November, December, and then, oh, it's Christmas. So I'll do it in January. Then normally it's not just one review. They want 1, 2, 3 reviewers. The editor will then compile those. There's a decision made. So I might say accept with minor revisions. The other person might say accept with major revisions. And another person might say decline this altogether. And that's at the editor's discretion to review those options and make a decision. And then they might come back to you, Josephine, and say, yep, we are happy to progress this if you make the following changes. And they might say, you've got a month to make these changes. So now we're February. And then it gets submitted again. And ideally, those same reviewers will review the revised manuscript. And you'll have written a response letter saying, yes, I've addressed your point A, B, C, and it's here in the manuscript. And then hopefully all goes well, then it gets accepted. So we're like March now, so what, 6 months in? And then after that, then it's editing, and the editors can take a bit of time actually getting it right. And then they might come back to you and say, oh, we need you to fix this, like from an editorial perspective, this image isn't clear, this isn't right. Can you fix these references? And depending on what that is, could take another month. So really anywhere between 6 months to a year could be the timeline from submitting something to getting it published. And that's, if it gets accepted or not. Most journals are pretty good in the sense that if they're going to reject you at the start, you'll know within a week. They'll look at what the synopsis of your paper is, and if it meets their scope and their audience type, they'll progress it on to find a reviewer. But if they're not gonna waste your time, make you wait 3 months for someone else to say no. There's that initial screening, and if they don't think it's a right fit, they'll say, look, sorry, don't think so. They might suggest another journal for you to submit to, which is quite helpful. But yeah, and then you start the process again with another journal. So yeah, 6 months to a year. Caroline, you have a question?
Yeah, I wanted to talk or
Oh, hold on,
ask a
sorry,
little
my
bit.
speakers are just turned off, so I can't hear you. That's a me problem. Just one sec. Go for it.
I wanted to talk and ask a little bit about there's kind of 2 sort of leaps. One is doing your own local quality improvement and then feeding that back at a local level. And then the next leap forward is then writing that up for a conference abstract. And then the next leap forward is that translating that into a publication. So I would say arguably anyone who's doing the NAPS should absolutely be doing that local quality improvement feedback to their own auditors and to that healthcare workforce population. And then probably arguably we would always encourage people to submit that as an abstract to a conference. But then I wanted to ask around your thoughts of how you then translate that, or whether you make the decision to translate that into a formal publication. And would you generally encourage everyone to do that? I mean, I know it's a function of maybe the local support network that they have within their hospital or facility environment to enable that.
Yeah, and that's it. You definitely need a team. It's a lot of work on your own, but also depends on going back to like what your data looks like and the scope of it. At a conference, they're more accepting of, like you're a small organization, so you're only going to have X amount of data, but we want to show it shouldn't matter whether you work at a regional hospital or a large metropolitan hospital, your results are your results. When it comes to publishing, though, there's a bit of a higher expectation on like a minimum number. So, every year annually for the NAPS, we say a minimum of 30 prescriptions for benchmarking. That's fine for benchmarking, but for publication in a journal, you'll get ripped to shreds that's not scientifically sound or significant to be a decent sample size. So in terms of pursuing for a bigger publication, I think the biggest consideration is, one, you have the support behind you, but 2, you've got a decent amount of data to do so as well. And I think it's also when you look at other papers around audit and feedback. Doesn't have to just be about antimicrobial stewardship, but general audit and feedbacks or drug use evaluation papers. What are the sort of sample sizes being published? But also, what would you think is acceptable? Like if you read a paper and there was only 50 ceftriaxone prescriptions audited, would you be like, oh yeah, that's groundbreaking research and I should adopt whatever they found? Probably not. But, if you've been collecting data for a couple years or even, do one big audit and you've got over 100 plus prescriptions, that's something to consider. But the biggest thing is context and where you want to submit and looking what also exists in the literature. If someone's already done that ceftriaxone audit and published it and they had 500 prescriptions and you've got 50, what are you adding? I guess the other bit is like, what are you adding to the literature? You want to add to the broad, like we do research to add to the literature to generate knowledge, to, build upon what exists and what we know. And you're not really adding much if it's a really small sample size of something that's already been done before as well. So, yeah, I guess, I mean, if people had some examples that they wanted to give in the chat, we can go through that context, but as a broader general message, that would be my thoughts.
The other thing I suppose to think about is if you can collaborate with some other sites. So if you've got people around you who are maybe also small, and then make it a multi-site thing, that might help too.
Yep. And the only implications for that would be that you just have to go through the process of a multi-site ethics, which, we can try help navigate too. But yeah, that would be a great opportunity. And similarly with our large data set, we can't tell you the names of the hospitals because that's just our processes. And, when people have signed up to the NAPS, that's something that we've always kept anonymous. But if you wanted to know the names of the hospitals, you would have to get those hospitals to agree and consent to that. So that is a you problem that you would need to organise with your local organisation. So we could give you, so for example, there is a network of hospitals in New South Wales, and they want to do a project. The person at hospital A wants to get all the data for all the other hospitals. And again, they would have to seek consent from all the other hospitals. But then if they were all consenting and wanting to do a group project, then we could give you that data and we would be able to name those hospitals because those hospitals have agreed to be named. You will probably still not name them in the publication, but from a knowing where the data came from, and vice versa, that would be the workaround. It's just more highlighting that we don't give out hospital specific data and name hospitals without that hospital's consent. Like that's a very core component of our NAPS program. But great questions.
That's great. Nobody's asked anything in the questions and answers box, but I'll take the opportunity to plug about our Antimicrobial Awareness Week event that is happening on the 22nd of November. I've placed a link that takes you to our promotional page, but we'll be hosting a one-day in-person event at the Peter Doherty Institute in Melbourne, Victoria, Australia, for those interested to learn more about building workforce and capacity for research around antimicrobial stewardship. Okay, and I think what I'll do is I'll end the webinar now. Next month's topic is on aged care NAPS, and specifically it'll be Nolene Bennett presenting about quality improvement and using data to inform research and feedback. Thank you, everybody.
Thanks everyone. Bye.